about which formula milk is best for a 1-year-old? Or is there a way to choose or decide on this?
Okay, so I mentioned earlier dun sa previous question na pagtungtong ng one, usually parang family food na. So, konti na lang yung milk requirement nila. Actually, the American Academy of Pediatrics recommends na lang that at 1 to 2 years old, 2 to 3 cups of milk na lang per day. And between 2 to 5 years old, mga 2 to 2.5 cups per day na lang yung milk. Ibig sabihin, mas marami na talaga silang solids dapat na kinakain. Na that being said, at 1-year-old, you can actually offer whole milk na, not necessarily toddler formula. So you already have an option. Not unlike na pag less than 12, dapat infant formula kasi hindi pa nila kayang i-digest yung protein in cow's milk. But starting 1, there's an option whether you can continue your formula pero toddler formula na or whole milk. Now, as for the best formula, I think maraming factors ang kailangan mong i-consider dyan. Unang-una, the cost. Pangalawa, the taste. Kasi there are some babies na very particular with the taste. Iba-iba din kasi yung taste nila. And then, make sure lang siguro na, although lahat naman, most toddler formulas in the market are, nutrition-wise, almost the same. Ang dami na may mga fortified with ganito, fortified with ganyan. So, parang nutrition-wise, almost the same sila. So, doon na lang sa other factors siguro yung pagbabasihan mo which specific brand of formula you want for your 1-year-old.
Thank you. The next one is a question on latch and pump practices. Not quite sure what that is.
Okay, sige. So, I'll enumerate siguro 3 points to remember for pumping and latching. So, sa pumping muna. So, first, pumping setup is important because when you're pumping, you're mimicking the natural breastfeeding experience where the baby is with you, skin to skin kayo ni baby. So naturally, all the hormones will, work to produce the milk. When you're pumping, you have to recreate that. So ibig sabihin, the setup is important. Kung kailangan na meron kang dedicated space sa house or sa work mo, mas maganda. If you need music to relax, mas okay yun. Hindi dapat rushed. So usually, especially for working moms, usually rushed yung pumping nila eh. So affected yung output. As much as possible, you are in a relaxed state. Bawal ang stressful thoughts. Bawal yung nagpa-pump ka tapos iniisip mo na may meeting ka pa at ganitong oras. Kasi that affects the output. So yun, the setup is important. Also, another thing, don't be too focused on the output. Actually, there are some experts who recommend that when you're pumping, you cover the bottle with socks para hindi mo nakikita. Kasi sa tendency when you're pumping, tinitingnan mo, ang konti pa lang, ang tagal, ba't ang konti? So actually counterproductive siya. Mas konti yung lalabas kasi you keep on thinking about it, hindi ka relaxed. So yun, some experts would advise to cover the bottle with a sock. So just relax and do the pumping. And another thing, yung na-mention ni Mommy Joyce kanina na, di ba, she said that when she was pumping, konti lang, pero she's very sure naman na maraming nakukuha si baby. So actually, yun yung isang point ko. Do not use pumping as a measure of parang trying to gauge how much milk you're making or how much milk baby is getting. Kasi it's not a very reliable indicator. There are reliable indicators that will tell us that your baby is getting enough. So weight gain, number of feedings, number of poop and pee. So those are reliable indicators. So minsan kasi like straight from the hospital, konti pa lang yung milk magpapump and then konti makukuha. So nadi-discourage na sila kasi akala nila ganun lang din kakonti yung milk nila. Pero so yun. So sa latching naman, one thing, a good latch doesn't have when your baby is latched properly, walang pain. Okay? So yun ang kailangan natin tandaan ng mga mommies natin. So almost always when there is pain, it means that the latch needs to be improved. A good latch will mean a painless, pain-free breastfeeding experience for you, and the baby is optimally getting milk kasi tama yung latch niya. Also, while breastfeeding is natural, meron talagang learning curve for mothers and babies. So especially kung merong mga medical problems silang na-encounter during birth or ano. So, it's possible na medyo hirap pa si baby mag-latch during the first few days, but with the proper support naman of an expert, of a lactation consultant, matututunan din ni baby mag-latch. So I guess yun lang yung mga parang top 3 na pointers ko for pumping and latching.
And I think that's so significant when you talked about na may learning curve na siya. Only because if you hear natural, it's as if everybody should know how, and apparently it's not that easy for everyone, and that's normal.
Yes.
Okay. I'd like to just close our session with the last one. If you could give maybe your top 5 advice for breastfeeding moms.
Okay, sige. So first, siguro prepare. Just like this is not this doesn't apply only to breastfeeding. So just like in any other like plans or endeavor that we have, di ba, when you're prepared, there's more chances of success. Parati kong sinasabi sa mga parents ko na it's just like planning a party. You don't plan a party the day before and expect it to be successful. So same with breastfeeding. Minsan kasi kanina, so parang inisip natin, oh, natural naman yung breastfeeding. I don't think I need to prepare for it. Pero they learn too late that they should have prepared. So sana when couples are still pregnant, that they take time to prepare either through classes or read books or maybe read articles or get experiences from other breastfeeding moms. So preparation is a good way to have a good start at breastfeeding. Next tip, surround yourself with people who support your decision. Okay, and not just with family. If you have the choice, also go with healthcare providers that support your choice of feeding. Kasi it will be a source of stress kung every time you go visit your doctor, alam mong hindi kayo magkikita eye to eye about how to feed your baby. So get also a healthcare provider that supports your decision. The third one is each breastfeeding experience is different, especially to those na have more than one kid. So magkakaiba talaga. So don't expect, for example, sa firstborn mo medyo stormy yung breastfeeding experience mo. It doesn't follow na pag sa second child ganun din. Vice versa. During your first child, baka wala ka masyadong challenges, pero during the second may challenges ka. So each breastfeeding experience is unique with each child. And then another one, ito yung medyo kulang din sa moms. Do not be afraid to ask for help early on. Mahilig tayong magtiis no, not just in breastfeeding. So parang sige, kaya pa naman, okay lang. May konting pain, kaya pa naman, okay lang. So I would advise kahit minimal pain, if you think you need support or if you have questions, ask help. Okay, it's not a sign na you're failing or ano. It's better to be prepared. So ask help early on. And the last, for breastfeeding moms, actually for everyone, take care of yourself. Okay, nutrition wise, physically, mentally, because if you're not taking care of yourself, how will you be able to take care of your baby, your newborn, your family? Okay, so don't forget yourself also. Love yourself.